When I went, I told him, I said, I was diagnosed with a pituitary tumor about 3 years ago, you know, because it's right up on above the optic nerve. And I said, I know it's nothing to it. My doctor told me, go away, don't worry about it, see you around. It's not causing you any problems. I was having headaches at the time. And so when I got to Dr. Wang, I went through all the procedures and everything, and I still don't know today if he saw something in the, I believe that he saw something in the testing. And he, you know, I thought I was going to have my eyes done that day. And he called me in his office and he said, you know, he said, I don't feel comfortable doing this. And he said, and I was like, I was ticked, to say the least. And I said, well, I say it's okay, so do it. And he says, I know, but it's not okay. I need you to go see your doctor. And just get the, he said, you come back to me with a clean MRI, and then we'll talk about it. The next day I went and I had an MRI. Well, I had a brain tumor. Not anything remotely close to what they had diagnosed. And it was all over the place. In 2 weeks of finding this out, I had brain surgery, and it was major. And I was within like 5 months of dying. And he saved my life. And like I start crying when I talk about him, but he saved my life, literally. I call up and I said, you know, I want to make an appointment. And I came in and I told him who I was, and he was like, you know, I've been wondering what happened to you. I've been just wanting to know. And, you know, I was like, you don't realize. I kept telling him, you saved my life, you saved my life. And I still don't think he really understands that he literally saved my life. That afternoon, he told me that he had spoken to my surgeon and that he felt that everything was clean and that he did not have a problem with the procedure. And so Dr. Wang said, be here in the morning. And so I came and I did the surgery. And I left here and I went home, and I couldn't really, you know, it was kind of blurry at first. And all that night I kept waking up because I was blind. He told me that 2200 is blind and I was at least 24. And so I couldn't find my glasses if I didn't know where I left them. And so all night long I kept waking up and I would peek, you know, turn the TV on. And I was like, I can see this, it's getting better, it's getting better. And all night it got better. And the next morning, you know, I could see. And so I came for my follow-up, and I had 20/20 in one eye. For all of my life, I have been blind. And I never knew how to tell my parents that until I was like probably 10 or 12 years old. And I mean, they had been taking me to eye doctors, but you know, I'd get glasses, but they were never really strong enough. But to have to go through your teenage years with glasses when they were not cool glasses like they are now, and to, you know, just simple things like if you want to put your head on a pillow, your glasses get all smooshed up, you know, and they don't smoosh up anymore. You see what you see.
Well, you have met many of our patients, and I'm sure that you share many of their experiences. Perhaps you're like Joe, who has so many glasses that are lying around different parts of your home and offices, and whenever you need them, you can find them. And you would love to get rid of glasses and contact lenses and to be freed of dependence on them. Perhaps you're like Andrea Panames and their family, who has a loved one who suffered such a devastating, irreversible visual loss, and would love to find a way to help, to see again. Perhaps you're like Deborah, who's not only vision, but also lives has been impacted in such a fundamentally positive way and life-saving experience. Because the doctor, the staff care. At Wang Vision Institute, that's our fundamental commitment to you. We care, we want to provide the best quality care for your vision. I hope the experience of these patients have touched your heart as much as it has touched ours. If you have any further questions and would like to find out how can we help you, do not hesitate to give us a call. Thank you.
you've ever looked into laser vision correction, you know it's not actually all laser. There is a little cutting part that has to happen before the laser can work its magic, and that has been a big problem for many people. Not only is it the scariest part of LASIK, it is the most dangerous part. A few LASIK surgeries that do go wrong are mostly because of the flap cutting part of the procedure. But now a local surgeon is using a new type of laser that does away with the knife. He's calling it bladeless LASIK. Dr. MIng Wang says the most important benefit is taking human error out of the equation.
Second is reducing infection because no surgical blade sterilization. Number 3 is more precise cut. And number 4 is reduce the chance of needing redos.
The procedure takes the same amount of time, but there is more pressure involved as the flap is cut. You also have to be more careful to keep your eyes closed after the procedure for a while as the flap seals. And it costs $500 more per eye to get bladeless.
We have a big medical story to tell you about from right here in Nashville. This one involves the latest in vision correction surgery. For the very first time in Tennessee, LASIK eye surgery is performed without a blade. Doctors use a laser to lift the corneal flap instead, greatly reducing any chance of infection or scarring. The procedure has only been done a handful of times in the entire country, and this morning, Teresa Thomas became the first Tennessean to have it done.
Well, I can see now. I couldn't see without my glasses a couple of hours ago, and I can see. I can read the news, too, on your shirt, and I can see the clock and all of that. It's amazing, really.
The goal of LASIK eye surgery is to improve the eyesight of the patient so they no longer require glasses or contacts. Coming up tonight on News 2 at 10, hear from the doctor who does this new procedure and learn more about the benefits of bladeless LASIK surgery. Back to you guys.